Israel was the first country on Earth to fully vaccinate a majority of its citizens against COVID-19. Now it has one of the world's highest daily infection rates, an average of nearly 7,500 confirmed cases a day, double what it was 2 weeks ago. Nearly 1 in every 150 people in Israel today has the virus. What happened, and what can be learned about the vaccine's impact on a highly vaccinated country? Here are 6 lessons learned, and 1 looming question for the future of the pandemic. Israel had fully vaccinated slightly over half its population by March 25. Infections waned, venues reopened to the vaccinated, and the Prime Minister told Israelis to go out and have fun. By June, all restrictions, including indoor masking, were abolished. But Israel paid a price for the early rollout. Health officials, and then Pfizer, said their data showed a dip in the vaccine's protection around 6 months after receiving the second shot. It was a perfect storm. The vaccine's waning protection came around the same time the more infectious Delta variant arrived in Israel this summer. Delta accounts for nearly all infections in Israel today. The most influential event was so many people who went abroad in the summer vacations and brought the Delta variant very quickly to Israel, said Siegal Sadetzki, a former public health director in Israel's health ministry. The good news is that among Israel's serious infections on Thursday of this week, according to health ministry data, the rate of serious cases among unvaccinated people over age 60, 178.7 per 100,000, was 9 times more than the rate among fully vaccinated people of the same age category, and the rate of serious cases among unvaccinated people in the under 60 crowd, 3.2 per 100,000, was a little more than double the rate among vaccinated people in that age bracket. The bad news, doctors say, is that half of Israel's seriously ill patients who are currently hospitalized were fully vaccinated at least 5 months ago. Most of them are over 60 years old and have comorbidities. The seriously ill patients who are unvaccinated are mostly young, healthy people whose condition deteriorated quickly. Israel's daily average number of infections has nearly doubled in the past 2 weeks and has increased around tenfold since mid-July, approaching the numbers during Israel's peak in the winter. Deaths increased from 5 in June to at least 248 so far this month. Health officials say that currently 600 seriously ill patients are hospitalized, and they warn they cannot handle more than 1,000 serious infections at the same time. The country jumped out ahead of all other countries on vaccines, and 78% of eligible Israelis over 12 years old are vaccinated. But Israel has a young population, with many under the eligible age for vaccination, and about 1.1 million eligible Israelis, largely between the ages of 12 and 20, have declined to take even 1 dose of the vaccine.